Hello, I'm Nurse Zach, and tonight we'll be going over placing and removing an NG tube. Before we enter the patient's room, we would look over the charts for health history related to nosebleed, nasal polyps, aspiration, anticoagulant therapy, chronic sinus infection, or surgery of the nasal, sinuses, or facial regions. As we enter the patient's room, introduce ourselves, get two identifiers for Mr. Laerdal. His name and his birthday are most common. We would talk about the doctor's orders of placing or removing the NG tube. We would give the patient privacy, perform hand hygiene, place our supplies on its bedside table, and then talk with Mr. Laerdal. Talk about the reasoning or rationale of why we are placing the NG tube, why are we removing the NG tube, answer any questions, get a verbal consent that we're okay to move forward, and then also warn Mr. Laerdal he may experience some gagging as we pull the tube out. As we continue, we would assess Mr. Laerdal and ask him, do you have any pain, any nausea, any vomiting? Okay. We would place the patient in a high Fowler's position by raising the head of the bed up. We would raise the bed itself up to hip level. We would perform hand hygiene and then prepare our tape. Tonight I'll be using 3 pieces. One to anchor the NG itself on the patient's nose. Another to anchor onto the gown. And a third to measure how far I need to be placing this NG tube once I've measured it. So now I will be doing the assessment before conducting the placement and removal. We would don our clean gloves. And we would assess the patient's nose for any obstruction, any nasal polyps, any septal defects, or any inflammation or trauma to the mucosa. We would confirm with the patient any history related to nosebleeds, nasal trauma, or nasal surgery. We would test the patency of Mr. Laerdal's nostrils. We would assess the gag reflex of Mr. Laerdal. Auscultate the lung sounds and bowel sounds of Mr. Laerdal to understand how they were before we were to enter and see if we do cause any change. Next, we would then measure our NG tube. Start at the tip of the nose, go down to the xiphoid process, and then up to the tip of the ear. So on Mr. Laerdal, that is about 45 centimeters. So I'll mark that. We would then lubricate the first 4 inches of our NG tube. Insert the 60 milliliter syringe into this end of our NG tube, the port side. And as we enter, the goal is to go to the back towards the ear. and instruct Mr. Laerdal, once we've inserted, to put his chin down to his chest, and as we insert, to swallow to make sure that we don't enter the trachea but instead go down into the stomach. And swallow, and swallow, and swallow, and swallow. And once we've reached our measurement, we would anchor the tube to the nose. With one piece that we've torn. And then a little bit lower than the shoulder, right around where the measurement ends, we would create our anchor so we can bobby pin this or clip the safety pin this to the patient's gown. We would auscultate Mr. Laerdal's lung sounds again to be sure that we did not enter the trachea into the lungs, and confirm. Next, we would test gastric contents by removing gastric contents with the 60 ml syringe. We would test the pH of said gastric contents, and then also confirm that this patient will be getting an x-ray in case the tube is also going to be used for feeding, and then throw away the syringe with the gastric content inside. Clip this to the gown and clamp your tubing. For removing the tube, you kind of want to start from the head down. So first you would remove the tape off of Mr. Laerdal's nose, unclamp it from his gown. Alright, instruct Mr. Laerdal, you're going to hold your breath as we pull this out. You just kind of, not quickly, not rip it, but kind of quickly inch this out. It's not a pleasant experience. Control the tube as you pull it out so we don't flip any gastric contents. It is acidic. Confirm the tube that is intact. Nothing is wrong with the tube. Alright, we would then discard our tubing, our gloves. We would perform hand hygiene, reassess Mr. Laerdal of his comfort level, his pain level, how is he feeling now that we've removed the tubing. Continue by putting up the side rails, perform hand hygiene again, put the bed in its lowest position, lock the bed in place, give Mr. Laerdal his call light, thank you Mr. Laerdal, and perform hand hygiene as we leave the room. Thank you.